Okay, good morning. Now today we will start with another chapter. And whenever I have to start with a new chapter, it becomes very difficult for me to decide which chapter to start. Some of you are not much worried about your examinations coming, or maybe worried. But I definitely am worried that I have to complete my course or revision in next 30-40 days. I want to finish it before your send-up starts. Let us hope. What I am planning is to do topics which require some understanding and conceptions. Other topics which are just, you have to read and remember, like more of environment, nutrition. That I will be leaving if possible. But these topics I want to do. So today I am taking up the screening for diseases. Screening for diseases is an important chapter. Actually, all topics I have to say are important, but it's very important for those who are appearing in USMLE. USMLE, they always give a very slightly higher level of questions in screening, which is beyond what we do in normally undergraduation. So we have to even go beyond what we do, which I will be doing it in my third or fourth talk on screening. I will be going for what USMLE discusses or asked. But prior to that, we will keep to our undergraduate level. For the students who are like me, who just want to get through the problem, I will be teaching 4 or 5 concepts today in screening. First is, screening is done because we want to detect the diseases early, and we have studied in chapter 2, Basics of Health and Disease, that there is a hidden iceberg phenomena. The iceberg phenomena is a phenomena in which a large portion of disease is hidden, and we have also studied in detail what is the problem caused by this, what is the advantage of detecting it early. It is for both preventive and for better and cheaper curative of that person. If I detect, I have given this example, if I detect cancer cervix early, it is good for the patient, it is good for me, it is good for society, it is good for financial aspects. So screening is related with iceberg phenomena. Screening is a process in which we want to diagnose the disease early. And diagnosis of the disease early means we have to diagnose what is hidden in the community. So screening is an early diagnosis and treatment is a concept or a definition of secondary prevention. So screening is secondary prevention. I will come to it later. Sometimes screening can become primary prevention, but the primary role of screening is secondary prevention. Periodic medical examination versus screening, because the textbook has mentioned, so sometimes NEET can ask. Periodic medical examination is more personal in nature. The President of America or President of India, they undergo periodic medical examination. And you can visualize when some Bidayan will go medical examination every 6 months. He will be examined by specialists and they will do all type of the best possible tests on him to detect diseases. But in screening, we are going to masses. First, we are going to masses. So we are not doing an individual test. And secondly, we cannot use sophisticated test. I cannot take my MRI machine in a village and start doing screening for some cancer or some disease using MRI. I have to take tests which are more practical, which are feasible, which are cost effective. And I cannot take my 20 super specialists to village for screening. They will go for President of America or President of India. But for normal screening, we cannot misuse our resources. They are required in the hospital. So screening is a mass, done for masses, using less level of medical expertise and simpler, cost-effective tests which are non-invasive in nature. If the tests are invasive, people may not opt for it. The third concept is screening test versus diagnostic test. There is a chart made in our book which is self-explanatory. Screening tests are cheaper, faster, non-invasive. They are not basis for treatment. They are not basis for diagnosis. If screening test detects me as diabetic, it doesn't mean I am diabetic. This means my chances of being diabetic increases. So screening, I will undergo another test. So screening tests are not diagnostic, and once the test is not diagnostic, so I am not put on treatment based on screening test. These things are simple. When you read it twice, you will understand. The only point we have to understand is the Park has written, the screening test, the results are arbitrary and fixed. This concept, this phrase we have to understand. How can a test is arbitrary, which means it is not fixed. A arbitrary thing means it is changing, it is arbitrary. We are changing, we are not yet decided. And it is fixed. So both things are contradictory to each other. So my understanding is the test results are arbitrary. This means, take the example of blood sugar. I have taken a glucometer to a village and I have started doing screening test for blood sugar. Now what cutoff I put for diagnosing those who are suffering from disease and those not suffering from disease is arbitrary. I will decide. If I want to diagnose more, I will keep the cutoff low, 120. I can keep the diagnosis that anybody who is more than 120 milligram random is considered as test positive, or I can keep it 180. So this is arbitrary. And what is fixed? Fixed is once we have cutoff that person meets the cutoff. Say he is 180 or 181, then he is considered as diabetic. He may say, no sir, I had a lot of sugar in the morning, or he may give a reason that I am on this drug, that may be a reason for. But for us, he is screened for diabetes. So the test results cutoffs are arbitrary, but once the test results come, and then it is fixed. This means this person below this cutoff which we have decided is not suffering from diabetes. The chances of suffering from diabetes are low or not there, and who meets the cutoff is. Last concept is most important. That is the screening times. Just pay some attention. There are 5 points. Remember, there are 5 points in a natural history of disease as per this chapter. The first point is where my disease starts. That is the point number 1. Let us take example of lung cancer has started in me. So that is the point number 1. The disease starts. And the last point, 5th, is where the disease ends or I end. So let us take in this example that I die because of that disease. So that is the beginning of the disease, and this is the end of the disease in me. Either the disease is cured or the person dies. So let us take the simpler example that I die. So these are the 2 points. The point number 4 is a point where I would get sufficient signs, symptoms and problems that I will report to doctor with say cough or hemoptysis or weight loss or some side effects of some symptoms of secondaries, and I will be diagnosed. So this is a point where normally a person who has suffered from lung cancer or suffering from lung cancer will be diagnosed. So this is point number 4. Now we have to do screening before it. Early diagnosis is to diagnose a person from suffering from disease before he himself or herself reports. That is early diagnosis. Probably I have told it also, and I will again stress it because we can always spend some time. If I today go with pain chest to hospital and my cardiologist diagnoses me as suffering from angina or IHD within say 30 minutes, it is not early diagnosis. He diagnoses me in 5 minutes, it is not early diagnosis. We have missed the bus of secondary prevention. The secondary prevention is to diagnose me suffering from CAD before I go to him, before I symptomatic. Once I have gone to him, he takes 5 hours or 20 hours or 5 minutes. It is not early diagnosis. It is not secondary prevention. So remember, secondary prevention, the tool is screening. Screening has to be done before that person reports himself. He is symptomatic. So screening test will be done somewhere here. Now why we can't do screening time in this time? So this is my point number 2. That is when I do screening. But why not do screening time here? Screening time we are not doing here. We will do here. But that test is not capable of catching the disease process. Remember the example of window period in HIV. HIV person in window period is suffering, his infection is infective. He is suffering from infection and he can pass or infection. But my test cannot detect it. So similar is the case with cancer lung. I am suffering from cancer lung. What say the best test in the world, the MRI or biopsies or CT scans will not be able to diagnose it, because let us take an example that only 10 cells have become carcinogenic. And neither they are giving any shadow, nor they are coming in biopsy. So this is a period in which we don't have any test. So our screening period is this. So this is the period in which we can do the screening. And this period is secondary prevention, because I am diagnosing the person here. But there is a point number 3 also. The point number 3 is in that chain of natural history is beyond which diagnosing me with cancer lung is not going to make a difference to my prognosis. Is it clear? So beyond this point, if screening test is applicable here also, it will diagnose me as suffering from cancer. It is still secondary prevention, because I have not yet reported. But diagnosing me here is not going to benefit me. I will still die at this point of life. But if you diagnose between these 2 points, then because the secondaries have, let us take example, the metastasis has not occurred. So my life improves. My quality of life improves. My length of life improves. The cost decreases. There is some benefit. Let us say there is some benefit. So that is called, this is a time when we will do screening. So this is the screening time. While this is the time in which we can do the screening. It is still secondary prevention, but the advantage is not there. So this period is early diagnosis period. So with this knowledge and base, you go back to the book and study these things. So this time is called lead time. Why it is called lead? Any time. Lead time is from here to here, but this time is also lead time. But this period is screening time. So with this discussion, you have to go back to book. Notes I have not prepared. Screening notes are not, I will not develop screening notes, because it is so nicely given in book and the subject is so important that there is no reason to further cut it. This subject we have to read even beyond what is given in book. So there is no, I am not advising any notes to you. You should read from book, and actually I want you to read from other books also, which I will be discussing. Thank you.